In our last video, we briefly touched on the link between insulin resistance and PCOS. I'm just going to go into depth a little bit here because it's vital for women with PCOS to understand the relation. Now, we all know insulin is a hormone which is released from pancreas in response to a meal, which is mainly carbohydrates. And insulin hormone actually helps to maintain blood sugar level by pushing the high blood sugar into the body cells where it can be utilized as energy. Now, what happens in PCOS patients is they have an insulin resistant state, which means insulin is present in their body, but it's unable to do its job or function properly. So, in PCOS patients, in order to keep the blood sugar levels maintained, more and more insulin is released, and this causes high insulin levels in the blood. High insulin can actually stimulate ovaries to produce more androgens or male hormones. And this is where all the problems start. High level of male hormones or androgens mean problems with periods or ovulation, and also that comes with skin and hair issues. Now, this 5% of weight loss is not only beneficial for periods or fertility issues, but also for skin and hair problems. It can actually prevent major obesity related health issues in future like heart attack and strokes. But the biggest question is how do we achieve this weight loss? Because it's really hard to do it in practice. Now, I tell my patients to put themselves on low carb or low GI or glycemic index foods because remember, carbohydrates is the biggest stimulator of insulin, and we don't want to create the existing problem worse. Less carbohydrates in your diet, meaning less stimulation of insulin, and the body actually gets a chance to burn the existing fat. Make sure it is otherwise balanced with good amount of proteins, a lot of vegetables and fruits on your plate. Try and avoid deep fried and oily foods because remember PCOS patients do have a high risk of high cholesterol in their blood. Alongside diet, extremely important is exercise. Now, 30 minutes of cardio 5 times a week, which is something recommended by all the societies to help lose weight. Alongside that, I would strongly recommend to do resistance training, which is extremely important for ladies to lose fat around the abdomen and other areas. There are no quick rewards here, and you would see the benefits at some point, but it has to have some consistency and commitment. Talking about some of the specific treatments of PCOS, it really depends on what your major problem is. For example, if somebody is struggling with irregular periods and she's not planning to get pregnant, the best option is to go on contraceptive pill. That would not only regularize your periods but also help you prevent getting endometrial cancer or cancer of lining of womb in future. If someone was planning to get pregnant, then there are a number of fertility treatment or ovulation induction drugs that the specialist can prescribe. Metformin is one of the medications that we have been using in PCOS patients, especially if you have carbohydrate intolerance or diabetes itself. Some people also use metformin as an additional therapy for ovulation induction. And metformin is actually a drug which sensitizes you to insulin. So it does help combat your insulin resistance. If somebody is having real issues with skin and hair problems, then there are certain contraceptive pills which can actually help with skin issues, but there are also anti-androgen drugs which can help resolve the skin and hair problems. But it does take a long time and it does require a lot of patience because there is no quick fix for these problems. Last but not the least is looking after your mental health. I cannot stress enough how important it is to do this. I tell my patients it's okay not to feel okay sometimes. We all do that. But it's important to seek advice and get help at the right time. PCOS patients do have problems with anxiety and depression. It could be to do with their weight or fertility issues or skin or hair problems. But my advice would be to do some regular exercise. It does help fight depression to some extent and get some help at the right time. Good luck.